Today, nearly 6.5 decades after freedom, development is focused on the country's big cities. India's soul lives in her villages. For India to discover her soul, she must develop her villages, says Mahatma Gandhi. One big challenge that Indian villages face, particularly in the north, is that of inadequate healthcare infrastructure. After the government, it's the Catholic Church that runs the most number of healthcare institutions in the country. The hospitals run by the Catholic Church help serve the poor people struggling in the rural areas.
The Church has been very much involved in the service of our country and in nation building, particularly in the fields of education, healthcare, and of late much more in social development. CARD, Coalition of AIDS-related Diseases, has been a big help in reaching out to the unreached areas of our country.
Healing the sick was an important aspect of the mission of Jesus, and the Church has continued this ministry wherever it is present. Today, the Church continues to serve hard-to-reach areas of India through her healthcare centers.
TB is one of the major public health problem of our country. And when we say TB, immediately the thing comes that TB affects lungs. We should immediately act. Act means that the person who is having the cough for more than 2 weeks should get his sputum examined, because the sputum will come from the caseated tissue of the lung, and the sputum should be examined under microscope using zeal Nielsen stain, under which the lab technician can see the Mycobacterium tuberculosis. And this is a simple test. This designated microscopy centers are available very near to people.
The Church runs a large number of big and small hospitals across India, of which about 85% provide healthcare services in rural India.
CBCI CARD is a coalition of several health and development organizations which are very much committed to the poor. Among them are Catholic Health Association of India, Caritas India, Nurses Guild, and Sister Doctors Forum of India. We all are spread out in the whole country. About 15% are hospitals which are in the cities, and 85% of these members are all spread out in the villages, giving most primary health care to the poor and needy, especially those who do not have the access to the care.
At present, CBCI CARD participates in the National TB program with operations in 19 states across India.
Diocese of Daltonganj is spread into 3 districts of Jharkhand, and the speciality of our area is that the villages are very rural. Our health centers almost all are situated in these remote villages. Concentration is in primary health care and then community health care. If people cannot come to our health center, we go there and then try to treat them. So that it's a kind of mobility is also there. Going means a kind of health at the doorsteps of the people.
In the history of Catholic healthcare services, pioneering nurses traveled on foot through difficult terrain and circumstances, bearing boxes of medicines on their heads to treat the ailing in the remote villages. Following the mandate given by Jesus Christ, the divine healer, the sisters reach out to these unreached and neglected people.
The Nazareth Hospital Dot Center is one of the high-performing dot centers with 68 patients presently taking medicine under dots in the RNTCP program, out of which 2 are multi-drug resistant TB cases. The multi-drug resistant TB services in the state of Meghalaya was rolled out earlier this year, and already 3 Catholic health establishments are providing dot services for the MDR patients.
CBCI CARD is implementing 2 Global Fund supported projects with the objective of bringing down the burden of TB in India until it ceases to be a public health problem.
CBCI also has an office for health. Besides the routine and the normal functions that an office of the CBCI take care, this also concentrates on the malaria patients, the TB patients and the HIV patients. That particular section of the CBCI Office of Health is called CBCI CARD. And hundreds of patients belonging to these 3 categories are well taken care of throughout India.
Catholic health facilities are present even in the most challenging Maoist-dominated regions of Jharkhand. These facilities, which are run by trained nurses in collaboration with the government doctors, contribute to the National TB Control Program. Sanjeevan Hospital in Latehar, Jharkhand, which is a member of the Emmanuel Hospital Association, provides technical support to our Catholic health facilities. This hospital also coordinates the TB unit in the area.
Many of the time, we are the last resort for even very complicated cases, and by God's grace, we have been able to manage quite a lot of sick patients.
The health providers of the church network also make sure that the TB patients, after the free diagnosis, receive their TB medication regularly.
Through this project, we are trying to link the RNTCP program, the National Tuberculosis Control Program of the Government of India, into our healthcare network, the Catholic Church, Catholic hospitals, so that there could be more coordination and working together. And we should somehow always remind us that healthcare is a noble mission, and it should be a continuation of the healing ministry of Jesus, bringing comfort, consolation and healing in the midst of human suffering and vulnerability.
In Patna, the capital city of Bihar, the Holy Family Hospital plays a key role in coordinating healthcare activities in the area. This hospital also implements the TB prevention and treatment schemes facilitated by CBCI CARD.
More than 60 years, this hospital is run by medical mission sisters. Since 2000, Sisters of Charity of Nazareth joined medical mission sisters, and the hospital is run as partnership. This is the first and the only hospital in India run by 2 congregations as partners. There are more than 10 congregations of sisters and fathers work here as collaborators.
Meghalaya means the abode of clouds. Nestling among mountains and valleys, Meghalaya embodies the fragrance of nature and is home to a very hardworking people. In their daily struggle for a livelihood, TB is an additional battle to be fought. Under the circumstances, the church's volunteers often come to their help.
The CBCI CARD project has been contributing to the revised National Tuberculosis Control Program in the state in many ways. 8 NGO schemes have been signed in the state across different districts, in addition to 22 centers which are functioning as DUT centers.
CBCI CARD is also networking with the Catholic Health Association of India. headquartered in Sikandarabad, which has been working for over 70 years in the healthcare field. CHAI, with its community health focus, reaches out through its member institutions across the country.
Speaking about CBCI CARD RNTCP program, I would say this is one of the best projects that the Global Fund has initiated in appreciation of the Catholic Church's work in the field of tuberculosis. CHAI membership is over 3,300 institutions, which is spread across the country, specifically in the rural areas. Today, CHAI stands as one of the largest non-profit organizations in the health sector.
Members of the Catholic Health Network have been reaching out to places and people that are unreached, consistently saving the lives of those most in need.
These Catholic health facilities range from a small dispensary in some remote village to huge corporate style super specialty hospitals, various nursing schools and colleges and medical colleges. Our mandate is to go to them, to study them, their infrastructure, to find out their strengths, to liaise with the local government officials and look for gaps and demand for various type of facilities that are there.
Since the mandate of the Church Healthcare Network is wide and far-reaching, it is able to give attention to holistic healing in addition to dealing with specific diseases.
CBCI CARD has good network and dedicated and committed staff. It is a faith-based organization. It is giving so much help to the poor and needy patients. They are offering houses, pensions, scholarships, like that.
TB causes the most number of deaths due to infectious diseases in India's villages. And according to the latest estimate, nearly 1,000 people succumb to the disease daily. Approximately 2 million new cases are affected by TB annually.
Kshay is a Hindi word, it is called TB. If we put A before Kshay, then it became Akshay. That became TB free. It is funded by Global Fund against the fight to TB, HIV and malaria. It is an initiative with the objective to improve, to access the quality TB care and control services through the partnership between government and civil society.
The Catholic health facilities ensure that TB medicines are regularly made available to the poor through directly observed treatment centers, either institution-based or community-based. These DOT providers also make sure that patients adhere to the prescribed medication by regular follow-up. Ultimately, the CARD projects aim to improve access to quality TB care and control through partnerships between the government, church facilities, and civil society. HIV/AIDS is another burden faced by the people in India, and a TB/HIV co-infection adds to their struggle. So, CBCI CARD, through its TB/HIV scheme, alleviates the suffering that they endure.
Then it had been a joy for us working in this CCC, because we have seen so many people becoming much better and going back to their work. And our main concern is to create a positive attitude in them, because most of the people come here are discouraged once they get TB, AIDS, HIV positive, they think that is the end of their life. So we are trying our best to create a positive atmosphere for them in the CCC. Also, we take all the effort, make all the efforts to give them positive counseling. Also, their families or friends, whoever are coming with them.
In addition to TB and HIV, the Catholic Healthcare Network also works on other communicable diseases, non-communicable diseases, and maternal and child health. In all the above areas, the approach followed covers health promotion, disease prevention, curative services, and rehabilitation.
Sisters are available 24 hours. Whatever be the cases, sisters always reach out, help them, and advise them if they are serious. So that actually helps people in many ways.
As per the healthcare policy of the Catholic Church in India, these Catholic health facilities also collaborate with the national health programs. The healthcare network and the social development network of the Church are interlinked, and wherever possible, the two networks join hands to promote health.
Caritas India does not work on formal health, but she does work on informal health, basically what we call community health program. And that's why we have a link worker scheme which works on HIV and AIDS in Gujarat. We work in 12 districts. We are also working training ASHA workers in Bihar. We are working in 10 districts in Bihar, and we are working in all the 7 states of Northeast on malaria eradication program through Government of India. And all these programs indeed are government programs, and we are very happy to work with the government and collaborate with the government.
CBCI CARD's aim is to reach the unreached.
Actually, from 2008 onwards, we are given from under the CBCI CARD program. They are actually adherence scheme we are given, under which they are doing a very good work in this aspect, and we are given also training to all the members under the societies, whether in DOTS program, how to implement the DOT in the society. Actually, after the diagnosis of the patients, immediately they rush up to the patient's house and they are counseling very well.
The vision of the health policy of the Catholic Church in India envisages a healthy society where people, especially the poor and the marginalized, attain and maintain holistic well-being and live in harmony with the Creator, self, one another, and with the environment. The Catholic Church strives to continue the healing mission of Jesus in India, based on the mandate received from the Divine Healer to ensure life in its fullness and inspired by His compassionate love. The smiles that radiate from the India's villages owe much to the selfless service rendered by the Catholic Church and its various healthcare institutions. Let these smiles grow in a bouquet. Ultimately, a healthy people thriving in the lap of pristine nature build up a healthy society and nation. This was the India that the father of the nation had dreamed of.